Good morning, everybody. I'm extremely pleased to be here at the Royal Prince Alfred Hospital in Sydney alongside the Prime Minister of Australia, Scott Morrison, the New South Wales Health Minister, Brad Hazzard, and many key staff, our frontline workers in the New South Wales health system. We are all extremely pleased and excited that the vaccine rollout will commence on Monday here in New South Wales, and RPA will be one of 3 hubs where within the course of 3 weeks, 35,000 frontline workers in quarantine and throughout our health system will receive the vaccination. It is a complex but simple process for us, for those of us who will eventually get the vaccine, and especially for those people who will get the vaccine on the first few days. The Prime Minister, myself and Minister Hazzard have just had a walkthrough, and I want to thank all of the staff involved in the process. They've gone through a number of processes of dress rehearsals, for want of a better term, to make sure everything is precise and ready, and also to make sure that, especially with the first vaccines that are administered, that we have good observation, good data and good information to support everybody through the process. It is a mammoth task but a critical task and a game changer in dealing with the COVID pandemic. I'm incredibly proud of Team New South Wales and the way everybody has worked together, and the vaccine rollout is an example of that, and I want to thank the Prime Minister and his team for facilitating the supply of the vaccine, but also working with us in making sure it's distributed as efficiently, as safely as possible. And it is no doubt going to change the way in which we live with COVID. It does change the way in which we will think about the restrictions and life. However, in the meantime, until there's a critical mass of our population who've been vaccinated, we all have to stick to the rules as strictly as ever. We can't be complacent during this time. We're in a transition phase. We cannot be complacent. The second that we're complacent, community transmission will occur and we'll go backwards, and that's something we don't want. What we need to make sure is during this transition phase that we continue to follow the health advice, we continue to get tested even if we have the mildest of symptoms, and that we make sure that when we're available, we have the opportunity to take the vaccine, that we should take it, and that is really important. As you know, both the Pfizer vaccine and the AstraZeneca, when that arrives as well, have different ways in which we need to store them and get them out to our communities, and that's obviously a factor.
Medical call.
That's okay, it's a medical emergency. But obviously that also has a factor in how the vaccine is distributed and the cohort of the population that will be invited to have the vaccine. I believe very strongly that the overwhelming majority of our population in New South Wales will be very keen and eager to get the vaccine, but I also understand that people want confidence in the process, confidence in the efficacy, and can I assure you that when my turn is here, I will be getting the vaccine as quickly as I can. I think it's an extra line of defence, and the more of us that get the vaccine as soon as possible, the better it is for everybody. And can I thank the federal government for the supply? They've made sure that there's enough doses for everybody, and we're looking forward to be able to roll that out in New South Wales. Obviously the PM will say a few words, and then we're happy to take any questions. Thank you.